friends, due to the malnutrition and hygienic problems and some environmental factors, we face the various kind of health issues in which many kind of disorders and health issues generates in our body. One of them that is called blood cancer. Friends, yes, today I'll be talking about all the things regarding the blood cancer, its diseases, causes and possible treatments. Yes, friends, if I talk about furthermore about the blood cancer, first of all, we will have to understand what is the blood cancer, how it occurs in our body. So first of all, we will have to understand that it's a kind of autoimmune disorder in which our own mechanism of defense system in our body, mean to say the immune system in our body, it understands to our own mechanism, to our own defense system like an enemy. Mean to say, by mistake, our immune system understand that is our antibodies from our body side are enemy for them, and it attacks on them particularly, and it damages its cells, organs in their body as well. So if I say thoroughly about the blood cancer, so first of all I would like to say that autoimmune hemolytic anemia. Yes friends, autoimmune hemolytic anemia is a kind of blood cancer in which our immune system of our body, it produces the antibodies, but by mistake that particular antibody is attacks on our red blood curve cells, and that particular red blood curve cells are engulfed by our own antibodies, which have been excreted and prepared and generated by our own defense mechanism of our immune system. But that particular immune system is attacking on the red blood curve cells itself by understanding that it's a kind of enemy in our body. So that is a kind of disorder, and this particular disorder is called the blood cancer, in which we can say it's a kind of autoimmune hemolytic anemia. So friends, if I say about the another type of blood cancer, that is immune thrombocytopenia. Yes friends, immune thrombocytopenia is a kind of blood cancer in which the particular defense mechanism, mean to say the antibodies are generated and prepared by our defense mechanism, by our immune system, but that particular antibodies engulfs the we can say the platelet. Mean to say the platelet, whatever the body generates, are engulfed by our own antibodies defense mechanism, which have been produced by our body. So the engulf of the we can say the engulf of a platelet, in which the defense mechanism attacks on our own body's mechanism system. So this particular disease is called the cancer, in which we can say immune hemolytic cytopenia. Another type of the blood cancer, that is autoimmune neutropenia. Yes friends, autoimmune neutropenia occurs in our body. Mean to say, body is producing the antibodies, but that particular antibodies are engulfing the neutrophils. Neutrophils is a kind of the cells of our blood. So that particular neutrophils are engulfed and attacked by our own defense mechanism, our own antibodies in our body. So that's why it is this kind of cancer of blood is called the autoimmune cytopenia. Another type of the blood cancer is we can say rheumatoid arthritis. Yes friends, in this kind of disease, rheumatoid arthritis, sometimes the antibodies which have been developed by our defense mechanism system of our immune system. So antibody develops once, but sometimes it attacks on our blood vessels. Yes, inflammation which causes the damages our blood vessels, and sometimes that particular blood vessels are ruined and destroyed by our own defense mechanism system, that is our antibodies of our immune system. So in this kind of blood cancer that is related to the rheumatoid arthritis, so we can say it's a kind of blood cancer. Friends, another type of the blood cancer, that is called the lupus. Lupus, yes, it's a kind of autoimmune disorder also, in which kidneys and other vital organs are damaged and destroyed by our own mechanism of immune system in our body. So friends, till the study, if I say about the possible causes of the blood cancer, so first of all I would like to say that the genetic dispositions. So in this we can say the genetic dispositions, sometimes the people born from their childhood, we can say, so that particular gene transfer in their body, in the patient's body, and such kind of diseases are we can say autoimmune disorders takes place. So the genetic dispositions is also responsible for the causes of the blood cancers as well. Another possible cause of the blood cancer, that is the environmental factors. In this, we can say the environmental factors mean to say the direct cause of the toxins, heavy metals, as well as if you are going to directly touch with the pesticides, so it's a kind of possibility that you may be suffering with the blood cancer. So it's a kind of study which has been enlightened by the some scientists and which is being supported by the some theories. Some possible causes also have been carried out by the some scientists, like the infections. Yes, infections like the bacterial infections and sometimes the viral infections may also lead toward the blood cancer. So it's a kind of theory we can say. So infections are also involved in this kind of autoimmune disorder, which is going to be led kind of blood cancer. The another cause of the blood cancer, that is the hormonal changes. Yes, friends, sometimes in specifically if I say about the women's, so autoimmune disorder takes place due to the hormone changes also. Sometimes the menopause refers to the period cycle in a woman after the 40 years or 45 years. So post 45 years, it's a kind of the stoppage of the periods, that is called the menopause. So during this period, we can say there is a changes in the hormonal parameters, hormonal guidelines as well. So we can say it's a kind of responsible factor behind the blood cancer specifically. So as per the theories, it is being supported by the and enlightened by the scientist. So friends, you came through like the causes and some possible theories of the blood cancer. So first I would like to come on the topic, that is the symptoms. How many symptoms are there of the blood cancer? So first of all, I would like to say that is symptom, first it's diagnosed by the anemic conditions, like the patient if having or suffering with the anemia, so that particular patient will feel the fatigue and some tiredness, and the skin that is yellowish in nature, it can be observed. So this is a kind of symptom, first the tiredness and fatigue, and sometimes bleeding also occurs in the gums of the patient, and bleeding if the platelet is going to be very low. So sometimes if there is a wound in the patient in any organ of the patient, so bleeding may also takes place. So such kind of symptoms are also there. And joint pain and infections and sometimes weight loss also are there. So if the weight loss is going to be highly and rapidly going to be decreased in any patient, so this means it might be there that that particular patient is going to be suffer from the blood cancer or any other autoimmune disorder. So we can say these are the common symptoms in the blood cancer. So friends, if I say about the possible treatments, so first of all, doctors consults and doctors gives the advices to the patients who are suffering with the blood cancer. So the medications, the proper medications are given to the patient, but this is a very important factor that corticosteroids are given, and in the present scenario, if I talk that corticosteroids plays a very vital and crucial role in this kind of disease. And one more possible treatment is the blood transfusion. Yes friends, the blood transfusion is also very much possible and very much helpful treatment for this kind of disease, that is a kind of autoimmune disorder in our body. So once the blood transfusion takes place, the damaged blood cells replaces and the fresh blood cells are given to the patient. So sometimes it can be said that a kind of good and possible treatment for the blood cancer. The another one is that is a kind of possible treatment, that is we can say the immunotherapy, because friends, in the autoimmune disorder there is a excitement in the immune system in our body. So immunosuppressants are given. So immunosuppressants are a kind of category of the medications which are given to the patient. So immune system suppresses by this kind of medication. So that's why this possible treatment is called the immunotherapy. Another one that I initiated this video with this factor, that is malnutrition and some lifestyle changes. Yes, my dear friends, lifestyle changes are also consulted by the physicians or by the specialist. So lifestyle changes takes and gives a very we can say plays a very crucial role and vital role in our body. So lifestyle changes is a very much possible factor for the treatment of the blood cancer. So it can be said that it's a kind of treatment factor that is called the lifestyle changes. Even this particular advice is given by all the doctors, all the practitioners, all these specialists in it. Apart from these, some other emerging treatments are also given, like the gene therapy and some immunomodulatory therapy, but it's a very much important factor, that is we can say the transplant of the stem cell. So the stem cell once replaces, so it's a very much and although it's a very expensive treatment, but it's a kind of emerging treatment that is much and much possible in the patients who are suffering with the cancer. So that is called the stem cell replacement. So it's a very much successful treatment in the patients who are suffering with the blood cancer. So immunomodulatory and gene therapy and the stem cell replacement can be the we can say possible treatment in this kind of disease. So friends, I hope you understood and you have gone through as well and very well for the knowledge of the blood cancer. So if I say furthermore, I'll be making another videos if you are not gone through clearly through the blood cancer. So by the way, the blood cancers are now in the present scenario are having the various kind of blood cancers are there, but the possible treatments, possible causes, just I have told you in this video. Meet you in the next video by taking the factors, by taking the all other factors and medications which are the possible medications which are being given by the specialist, the cancer specialist in oncology department. I'll be making a separate video for that particular factors. So bye for now and in this video, and meet you in the next video. Bye.